Senior Ministry of Health officials led by Permanent Secretary Dr. Diana Atwine appeared before the Parliamentary Public Accounts Committee to explain the controversial government plan to bring into the country specialist doctors from Cuba. Lawmakers asked the PS to explain the decision.
Firstly, how did you arrive at the decision of importing 200 or so, we don't know even how many there are, doctors? How did you...
Is it sustainable? You are failing to motivate your own, and what constitutes ransom? Is demanding for better pay part of ransom?
When we were invited by the president at the time, at the peak of the strike, actually he instructed the prime minister to ensure that we look at that option. It did not, that the decision kind of stayed at that time because people were trying to look at how best this can be done.
It is said government intends to bring in 200 Cubans, and there are also claims that they would be paid $1,500 approximately 5.4 million Ugandan shillings monthly. The MPs asked how the figure was arrived at, but the Permanent Secretary said discussions were not yet complete, adding that she was not aware of any figure salary.
The decision of how much they should earn, who prepared this? Where did this come from?
If the doctors here have been complaining of low pay, you could have raised their money even to less than half of what you are paying the Cuban doctors.
No Cuban has come to Uganda. No, numbers are not yet known. How much is going to be paid is not known. The discussion is not yet taken place at strategic level to say this is a report that came from Cuba.
So where did the 5.4 million come from?
I don't know.
One of the ministers in the Ministry of Health mentioned to the Committee of Health, a sessional committee responsible for your docket, clearly that engagements have already been done. These Cubans, they are already preparing for the Cubans to come. Even the amount of money to be paid to them were, it was not a secret.
Dr. Diana explained that the idea to bring in Cubans was taken at the height of doctor strike, shortly after President Joe Museveni sent a high-level government team to Cuba for discussions. The team had Minister of Health Dr. Jane Ruth Cheng, Chairman of the Health Service Commission Dr. Pa Sogong, Deputy Secretary to the Treasury Patrick Ochailab, Solicitor General Francis Atoke, Permanent Secretary in the Ministry of Public Service Catherine Bitarakwati, and Chairman of Uganda Medical and Dental Practitioners Council Dr. Joel Okulo.
So who constituted this team that went to Cuba?
This team was constituted in that meeting when the president instructed that they need to look at the possibility of getting a replacement.
So the president made a list of those individuals?
They suggested in the meeting, he didn't make, but in the meeting, the decision was made who should represent what.
The MPs wondered why government had seemingly ignored the demands of Ugandan doctors and yet was quick to bring in Cubans for higher salaries and better terms of work.
We suggested that if we are to bring the specialists in this country, first of all, the specialists should come for a very short term, as government is looking into in the remuneration of the staff.
At least our doctors can understand Kiswahili, they understand Luganda, any other local language. How many of them are you going to attach each of them a translator to start speaking or translating to our illiterate patients who are coming all the way from Karamoja? They don't understand any other language apart from, I don't know.
Dr. Twine explained that the Cuban doctors would fill in gaps in human resources for health as specialists, and they were urgently needed. The Permanent Secretary stressed that Cabinet was yet to get a report from the team that went to Cuba and then make the final decision on the matter.
But when they came back, I think the decision is still yet to be discussed. It is because I don't have any information.
More research all NTV at Parliament.